I've received many videos over the last few months about conspiracy theory. Today I want to describe an element of the New World Order that is overlooked and very close to all your hearts. Neither is it new. All living things are mortal. This is not something that preoccupies young people, but for doctors it's a fact of life. Death is a reality that creeps up on people with advancing years. As they get older, they get increasingly frail and slowly lose interest in living. A point is reached when death becomes a desire rather than a fear. Only rarely is death painful. More commonly, people simply do not wake up one morning. Others catch a cold, which with the diminished resistance of old age, settles on the chest and carries them off with pneumonia. Before the advent of antibiotics, nature was allowed to take its course. Nowadays, before prescribing antibiotics to the elderly, doctors need to differentially diagnose a passing illness from a terminal condition. Once upon a time, family doctors did. If individuals wanted nothing more than death, antibiotics were not prescribed. If they are administered, death is prevented. Patients are treated for their last illness. They end up with a dead mind in a living body. They become geriatric vegetables. They then require constant nursing care at great expense to the family or the taxpayer. Thousands of jobs for the girls are created. Here are pictures of my own mother taken 2 years before she died. She looks like a victim of Belsen. Her last illness was treated with antibiotics against her wishes and those of the family. She lived on for 4 years. The cost was £80,000 that should have been the inheritance of her sons. She was negligently treated and her family defrauded. When visiting her, I caught glimpses of other patients in the nursing home. I estimated that a quarter of those being cared for were in a similar state. The owner could do nothing about it because of New World Order rules and regulations from Europe. Shortly after Mother died in 1999, he sold out to one of the many companies that have sprung up to exploit this fraud. But there is a far more sinister side to this state of affairs. Everyone should be aware of it. It will affect everyone one day, one way or another, if it has not already done so. In my autobiographical Puff of Smoke videos, I observed how in 1967 I discovered that the effect of cannabis was to increase suggestibility. I described how this increased suggestibility was being used to brainwash the post-war generation, the boomers, with revolutionary socialist propaganda. I mentioned Alex Trocky, the revolutionary socialist who made it possible for the black market in drugs, as we know it in Britain today, to be created in 1968. I told how he asked me to attend his dying wife. At his flat, I met a number of his revolutionary comrades discussing their subversive schemes. Because, unknown to me, they had already assassinated my character, so that nothing that I reported would be believed, they talked freely. I became an informal British intelligence agent with nobody to whom I could report. Unpaid, of course. One particular plot they were hatching in 1969 was to infiltrate the Royal College of Nursing. Nurses sympathetic to the revolutionary cause were to be recruited and quietly encouraged to promote litigation by suggesting to patients they had been negligently treated. This tactic had been massively successful in America. The cost of medical care had rocketed as doctors sought to protect themselves by ordering unnecessary investigations. American doctors lost the freedom to trust their clinical judgment and were thereby reduced to mere body technicians. The object of promoting litigation was to undermine the authority of the medical profession. It had been the smallest but most powerful minority in all societies since the dawn of civilization. It was an obstacle to the creation of the New World Order. As I gathered more snippets of intelligence over the years, I learned that some nurses were suggesting to the relatives of those who had died that their loved ones had been negligently treated. The effect was to reduce British medicine to expensive body technology like the Americans. The scientific common sense approach I had been taught by an earlier generation was abandoned as doctors played safe. One consequence was that the elderly were prescribed antibiotics and resuscitated whenever they fell ill, regardless of clinical circumstances, just as my mother had been. Thousands of geriatric vegetables were thereby cultivated. People talk of the New World Order, common purpose, the global village, and so forth. They are just new names for revolutionary socialism, with its avowed aim of controlling the world. Instead of debating conspiracy theories, it is time we stood up to those who are logging our details, stealing our identities, even DNA given half the chance, and increasingly controlling our lives. Let those who are watching us know we are watching them. Post this video to your friends. Smash YouTube records for most viewed, most subscribed, and most discussed. The media will then be forced to pay attention. View, share, subscribe, discuss. The future is in your hands, not theirs.